Chapter 24, Infestations and Insect Bites, a review from class in the Lewis textbook. Bees and wasps. These are a type 1 hypersensitivity reaction. Bee stings are the most common cause of death by venomous animal bites in the U.S. It results in skin, respiratory, and cardiovascular symptoms. Initially treated with intramuscular epinephrine 1/1000 and is repeated every 20 to 30 minutes. If there is no response or the patient is in profound shock, then 1/10,000 epinephrine intravenously is given. If the patient has extensive orofacial swelling, then the patient may be sedated and intubated. Other options and less severe reactions include bronchodilators and IV corticosteroids. The key is prognosis, prevention, and complications, because laryngeal obstruction is the most common cause of death. Patients with a history of allergic anaphylactic reactions should be given an emergency epinephrine kit with proper education. Bedbugs are small reddish-brown parasites that bite exposed skin. They feed on human and animal blood. Although bedbugs aren't known to spread disease, they can cause other public health and economic issues. They're about the size of an apple seed, and the bedbugs hide in the cracks and crevices of beds, box springs, headboards, bed frames, and other objects around a bed. The risk of encountering bedbugs increases if you spend time in places with high turnovers of nighttime guests, like hotels, hospitals, or homeless shelters. If bedbugs end up in the home, professional extermination is recommended. A bite from a bedbug could cause an itchy red spot, and it usually disappears on their own within a week or two. Some people will use a hydrocortisone cream or an oral antihistamine. If they develop a skin infection, it's usually from scratching the bed bites. In that case, they may be prescribed an antibiotic. Pediculosis. This is characterized by wheel-like lesions with parasites that attach eggs to the base of the hair shaft. It is possible to be infested and have no symptoms. People with pubic lice usually experience itchiness. It's worse at night when the lice become active and bury their heads inside the pubic hair follicles to feed on a person's blood. Pediculosis is an infestation of the hairy parts of the body or clothing with eggs, larvae, or adults of lice. The crawling stages of these insects feed on human blood, which can result in severe itching. Head lice, which is usually located on the scalp, crab lice in the pubic area, and body lice along seams of clothing. The body lice travel to the skin to feed and return back to the clothing. The parasites that live on the scalp will lay their eggs as nits attached to the hair, and the insects live off the blood of its host. They secrete local toxins that cause pruritus and location of the infestation. The epidemiology is that lice are spread via body contact or by sharing of clothing and bedding, and common in school-aged children. Medical management is pyrethine 5% shampoo or gel and is indicated in all cases of infestation, and it's usually available over the counter and applied directly to the scalp as directed. It may need to be repeated in a week to eradicate any newborn lice. To remove the nits, usually a fine-tooth comb is needed and is included in the shampoo kits. Scabies is a common skin infection that causes small itchy bumps and blisters due to tiny mites that burrow into the top layer of the skin to lay their eggs. Common symptoms of scabies is severe itching, which may be worse at night or after a hot bath. A scabies infection begins as small itchy bumps, blisters, or pus-filled bumps that break when scratched. The burrows sometimes appear as short, wavy, reddish, or darkened lines on the skin surface, especially around the wrists and between the fingers. Scabies is contagious and is usually transmitted by skin-to-skin contact or through sexual contact with someone else who is infected with it. The infection spreads more easily in crowded conditions and in situations where there is a lot of close contact, like child care centers or nursing homes. Medical management is topical anti-mite cream and sterilize the laundry. This is the first-line therapy for patients in all contexts. The Promethean 5% cream can be applied to the entire body for 8 to 10 hours, and it needs to be repeated in 1 week. Lidocaine cream is indicated when an alternative treatment is required. It's known to be less effective and carries adverse side effects in children. The main thing is to sterilize the laundry. Wash all the bedding and clothes in hot water the same day. Antihistamines and topical steroids might be indicated for hypersensitivity reaction to the dead mites following the treatment. Most tick bites cause only minor injury, but some ticks can transmit bacteria that cause illnesses like Lyme disease or Rocky Mountain spotted fever. To take care of a tick bite, it must be removed promptly and carefully. Use tweezers to grasp the tick near its head or mouth and pull gently to remove the whole tick without crushing it. Other methods that are not recommended is petroleum jelly, fingernail polish, rubbing alcohol, or a hot match. If possible, seal the tick in a container and put the container in a freezer. If the patient starts to develop signs or symptoms of an illness, then they may need to see what kind of tick caused the problems. Wash hands with soap and water, but also wash the area around the tick bite. Patient education includes when to seek emergency care if they develop a severe headache, difficulty breathing, paralysis, heart palpitations. They also must seek care if they develop flu-like signs and symptoms like fever, chills, fatigue, body aches, and a headache which may accompany the rash.